Welcome to Tracy. In this video, I will go over the basics of AI, including what LLMs or large language models like ChatGPT are, some things to think about with AI use, and some of the ways AI can be used by public health professionals and researchers. I'd also like to make a note that as seen on the screen, I have indicated with text whenever an image was created using AI. I did not use AI for the text or organization of the slides. Many of us got introduced to AI when ChatGPT came out on November 30th, 2022. Students found it immediately, but many of the rest of us were taken by surprise. In reality, AI programs have been around for decades, but the release of ChatGPT made the technology more accessible to the general public. Today, AI programs are being used to create images, videos, and sounds, write almost anything, be able to chat with customers, analyze data, review x-rays and test results for earlier detection of disease, perform surgeries, design houses and landscapes, help with research, everything from assisting with grant writing to doing lit reviews, analyzing data, and helping make the research more understandable to a wide audience. It can even help you plan a menu from what you have in your cupboard or recommend travel itineraries for you. AI can do a lot of amazing things, but there are some important limitations and risks we need to be aware of when thinking about how to responsibly use these programs, and that is what we're going to talk about today. So why is it important for us to talk about this now? Because there are thousands of AI tools coming on the market daily. The AI market is currently valued at around $137 billion, and it is expected to go to more than $1.3 trillion by 2032. These products are here, and they are being used. As public health professionals, researchers, and health communicators, it is important for us to be able to understand what they are and how to use them effectively and ethically. To really be able to understand and evaluate AI programs, I think it is important to have a baseline understanding of how they work. This video will give you that background. There are much more in-depth descriptions of how these programs work, and if you're interested in learning more, a quick Google search will give you some options. Okay, let's start with the perception that many people have about how these programs work. There's this thought that when you ask them a question, that there's this robot brain back behind the curtain that thinks about your question, does research on the best way to find the answer, and then shares it with you. But that isn't exactly what's happening, and we're going to talk about why. To start, let's talk about what LLMs are. LLM stands for Large Language Model. The one that most people have heard about is the AI chatbot built by OpenAI called ChatGPT, but there are many others out there. What can these programs do? You can ask them anything, you can have them write for you, you can even have them write code, analyze data, and many other things. But to really understand them, you have to know how they are built. GPT stands for Generative Pre-training Transformer. A generative model means that it can make new things, like writing a story or a sentence. Pre-training means that it was shown a lot of examples before it started working with you. And a transformer is a special kind of computer program that helps the model understand what words mean and how they're related to each other. Imagine it like a teacher that shows you many books and stories before asking you to write your own. GPT is like that teacher. It was trained on a lot of examples, and now it's ready to help you write. So how does a chatbot AI really work? It starts with how it learns. This is a dramatic oversimplification of the process, but essentially, source materials are selected and fed into the program. A complicated statistical model is developed to help the chatbot be able to use those source materials to develop answers to the questions that people have. The trainers then ask the model questions and modify the statistical model to help the program learn when it's getting the answers right and how to make the model better. So what goes into the model? Each program is using different source material and they are all proprietary, so we don't know exactly what is being fed into them. ChatGPT has told us that it includes some combination of web crawls, links on Reddit, some parts of English language Wikipedia, and some books. Some of the books they include are published and some are unpublished. However, it is unclear which ones have been included and which ones have been left out. It is important to note that the ChatGPT models, including the free and paid versions, are based on information available up until a certain knowledge cutoff date, which varies depending on the version. The free version of ChatGPT, currently GPT 3.5, has a knowledge cutoff of September 2021. This means that when you're using the free version, all of the answers it gives you are based off of information from before September 2021. It does not have access to newer data. The paid version, ChatGPT Plus, which is currently GPT-4, has a more recent knowledge cutoff of October 2023. While neither version updates in real time, the paid version does include browsing capability, which allows it to retrieve real-time information from the web when explicitly requested. This browsing feature is not automatic. It only activates when needed, and the sources it consults can be cited. Now let's look a little bit more at the training. The training helps teach the model patterns about how to put words and sentences together in a way that is most likely to occur in human speech. It looks at things like patterns in grammar and syntax to learn how to predict what the next logical word would be. Context also matters. If you ask the question, "What are bats made of?" it needs to know if you mean the animal bat or a baseball bat. They also train it to understand emotional tone. It is taught to be clear, polite, and respectful when answering your questions. It can also change tones based on the type of question. For example, it will use a serious and professional tone when answering medical questions, but switch to a more friendly and casual tone when answering questions about everyday things. Despite all of this training, it is important to remember that what it is really doing is using the model to put together the string of words that is most likely to answer your question. We've all seen this in practice. It's the predictive text you see in search engines and when you text on your phone. When you type a question into Google, you can see that it automatically guesses what you might be thinking about to make it easier for you. Same with our phones. This is a screen recording of my iPhone. You can see that it has the predictive text and the 3 little boxes at the bottom, even sometimes including emojis as options for me. These are guesses of what I'm likely to say next based on what I've already typed in. This is an oversimplification, but it helps me to use these examples to think about how the programs are actually working. Let's go back to those perceptions. Remember how we talked about how many of us think that there's a robot doing research for us, but what is really happening is that there is a statistical model guesstimating what the next best word is likely to be based on the words you used in your question? So why does this matter? These estimations of word pairings can lead to lies or mistruths or things that sound real but really aren't, even if you ask for citations. This leads to some limitations and risks that we need to think about before we really jump in and start using these programs. It's important to remember that these models are only as good as what you put into them. The data and the sources that are selected may have stereotypes within them. They may have biases. They may have misinformation. There is selection bias in what was chosen to train the model on, and whose voices and information was left out. And we've already talked about the dated information. There are also limitations of the trainers. Everyone, no matter who they are, sees the world through their own unique perspective based on their lived experiences. No matter how hard you try, you bring your biases with you. So we need to make sure when we are training the models that we have a variety of voices and perspectives at the table. If we don't, we're going to have models that are trained only on what their trainers think is a good answer, what their stereotypes are, what their biases are, even what speech and language patterns they are comfortable with. Let me give you an example of what this bias can look like. This is a visual example, but it gets the point across. In 2022, CNN tested this prompt to create an image with a wall and a royal castle. There are 2 paintings on the wall. The one on the left is a detailed oil painting of the Royal Raccoon King, and the one on the right is a detailed oil painting of the Royal Raccoon Queen. Given only the direction to look royal, the image it created was one of raccoons wearing Western-style royal outfits. This happens with text as well, and these can be subtle biases that can go unnoticed by some, but they are built into the programs by the nature of who is programming them. even if it's unintentional. We need to make sure that we have all different types of people in the room when the programming and training is taking place. Now, as I noted, this image and test was done in 2022 when the images being created by these programs were still not quite perfect. You can see there's kind of a weird neck thing going on, and the images were just not quite right. So I updated it recently to see if there were any changes. This was done in June of 2024. As you can see, the images are much better and much more crisp. They don't have that same weird neck thing going on, but the bias is still there. They are still wearing Western-style royal outfits. I wanted to give you another real-life example to show how this might impact you in a real-life scenario, since many of us might not be asking for images of raccoon kings and queens. This is an example from a researcher that I heard recently talking about how he wanted to have ChatGPT create an image for him to use in a presentation about some of the research he had done recently on golf-related injuries. He was shocked by the bias in the images that it created, so I wanted to test it myself. And this is what happened. I asked ChatGPT to help me create an image of a group of women playing golf. That's it, no other direction. And here is the image it created. I think this image speaks for itself. It does a pretty good job showcasing the inherent bias in the program. I don't know about you, but when I go golfing, that is not what all of the women look like. But there can be another side to this story. If you're aware that these biases are in the program, you can work to combat them. With a little extra prompting, I was able to get some images that were more representative, and honestly, might be better than what I have access to from stock photo sites. There are also some limitations to be aware of with the output. Some of the output can have biased content that may perpetuate health disparities. There are also some ethical questions around the development and use of AI programs. As we noted, they are trained on pre-existing content that was written or developed by someone, so the output isn't really original. It can also have output that is plausible sounding, but incorrect. And it does repeat phrases a lot. Some of the output can even be nonsensical. However, in the public health and research world, one of the things I'm most concerned about is when it has harmful instructions. It can put information out that sounds really good, and if you don't know whether it's right or wrong, you may think that it's giving you information that is helpful or will help keep your family safe, when actually it could put you at risk. So we really need to be careful and cautious about that. I really wanted to highlight the accuracy concerns because I think they're really important. As I've noted, it can have content that sounds good but is factually incorrect. This can be particularly dangerous if you don't know what the recommendations are yourself, or if it makes claims that could lead to harm if people follow them. If you are going to use these programs, please fact check everything. Another concern that people often bring up is hallucinations. A hallucination is defined as a confident response by an AI that does not seem to be justified by its training data. Some examples of this are inaccurate data. These programs have been known to make up data that they consider to be plausible based on its training. It can also be fake citations. This is where it makes up article names, journals, and authors that don't exist. They sound like they could be real, but if you don't fact check to make sure that the citations are actually real, you can put yourself into a situation that causes a lot of problems. Unfortunately, it sounds like this is a situation that is happening a lot with students who are using these programs to help with research and writing. There are also ethical questions around the use of these programs. Where the source data comes from can be controversial. All of the data is scraped from other people's work and used without their permission. This is true of texts, but it is also true of artwork, photography, music, and audio used for the creating of digital images, music, text, etc. There are also some examples of it spitting out content that is word for word from another place, like the Mayo Clinic, but it doesn't reference or cite it. We have heard lots of discussions about writers and creatives and coders who are afraid of losing their jobs to a program that stole their work. We also have to think about who else's data is being used without their permission. We're already starting to see some cases of people's biometric data being used to train programs, even when they haven't given permission for their medical data to be used. There are also questions of inequality. These programs are starting to cost money that may price some out of being able to use them. There are questions around how the wealth that is created by these programs is going to be distributed and who's going to lose jobs to these programs. I talked a little bit about combating biases, but this is really important. We've talked about biases that are in the data that are entered into the models, but there are also biases in how the programs are being developed. We've seen stories of software being used to detect future crimes that has showed bias against Black people. We've seen facial recognition programs that have a harder time with non-white people. We've seen bias in how the programs are being used, so it's something we really need to think about. I can see some cool AI programs being developed for use in healthcare settings and in public health, but we need to be careful that we aren't building biases into the program from the start to perpetuate what is already happening in many of those spaces. Okay, so I've said a lot of scary things, maybe even some things that are going to have you question whether or not you should be using them. But I do want to talk a little bit about what these programs can do. There are some really helpful uses for AI, and these are just a few examples. They can do things like save time by drafting emails, helping you analyze data, assisting with translations, creating outlines for presentations and talks, and much more. You can create personalized interactive learning materials. You can improve your grant writing by editing text, to tailoring your writing to funder styles, to summarizing grant requirements from an RFP, even to creating visuals and assisting with lit reviews. You can use it to increase representation and create images and text that are equitable, diverse, and inclusive. You can have it help you aid in your dissemination by simplifying research for lay audiences and creating draft press releases and social media posts, and even drafting outreach plans. You can have it track trends to spot trends early, which will help aid in intervention opportunities and predict outbreaks. You can have it help you brainstorm innovative approaches to behavior change and reduce health disparities by identifying patterns and disparities in access to care and aiding in the development of targeted interventions to reduce inequalities. Some examples that we've seen already are virtual health workers like Florence, who is the WHO's virtual health worker who was created to dispel myths about COVID-19 and smoking, and to help patients develop a personalized plan to quit tobacco. We're also hearing about driverless ambulances that have no need for the space required for a driver, which means more medical equipment will be available for emergencies. You can even think about the ambulances on the way to a car crash. With crash data that we already have, in combination with the details of the crash, the ambulance will be able to let the EMTs know which occupant of the car will be most likely to need medical care or be in critical condition before they even arrive on site. The image on this slide is from Volkswagen, who is saying that their goal is to make this a reality by 2025. That's really soon. There are also assisted living facilities with AI tech in the living areas that will be able to track things like if a resident falls, or if there are changes in the number of times the residents are getting up at night to go to the restroom, which might indicate a change in medical status. The AI systems they are using can alert the medical staff about potential medical issues. This will allow them to be addressed much more quickly than they usually are. AI is also being used for disease identification, analyzing medical images, accelerating drug discovery, optimizing healthcare operations, creating chatbots and virtual assistants that can provide immediate and personalized healthcare information. These are just a few of the many exciting possibilities, but no technology is perfect. And we need to make sure we have the right people at the table when the programs are being built and when organizations are deciding whether or not to use them. So if you are going to think about using AI, which I think we do need to do because it's here to stay and it's going to help us do some pretty awesome things, there are some things that we can do to help use it more effectively and ethically. When you use AI, use it to help create a structure while you create the content that goes in the structure. Think of AI like an intern or a co-pilot. It can get you 70% of the way there, but you need to bring your voice and your expertise. Assume that the data is wrong and fact check everything. And we need to make sure that we're inviting a variety of people with different backgrounds to have a seat at the table when these programs are being built and used. A few months ago, I attended an AI Impact Summit, and there were two quotes that really stuck with me. The first was, "It is no longer if or when you should adopt AI, but what you should adopt." The second was that AI won't directly replace humans. The humans that use AI will. I also like to think about another quote we often say in our team: "If you don't like change, you're going to like irrelevance even less." The computationally intensive tasks are going to be done by AI. How are you going to adapt, and how will you benefit? After listening to this presentation, what are you going to do to learn more about AI? You don't have to learn it all at once, but you definitely need to start. Spend an hour a week just learning about AI, playing with the programs, thinking about how it could help your work. Listen to a podcast, learn a little more. AI is here and others are using it whether you are or not. Let's make sure public health doesn't get left behind. If you enjoyed this content, don't forget to like this video and subscribe to our channel. Thanks for watching.
Looking for more HealthCom content? Check out all of our trainings and resources at cirtc.org.